Hello, my name is Taylor Guerin, and I currently work at Newark Wayne Community Hospital in the emergency room as a registered nurse. This week's discussion board touches upon chronic illnesses and diseases. The topic that I chose to pick was cancer, specifically breast cancer. We all probably know someone that's affected by breast cancer, whether they've been diagnosed, know a loved one, have a relative, and so forth. Breast cancer is prevailing, unfortunately, and is one of the most common cancers among women in the nation, second to skin cancers. Because of this, as well as next month, October, being Breast Cancer Awareness Month, I've chosen this topic specifically. When it comes to cancer, there's a lot of different resources and organizations, and the data can be confusing for loved ones as well as patients. I've chose cancer.org, the American Cancer Society, as my resource. I believe that all of the data is up to date, statistics are real, and can be validated. The website is easy and formulated for anyone to use, depending on your age, if you have technology background, if not. The website specifically goes over multiple types of cancer, but in particularly, you can find breast cancer on here. The site's easy to locate. Right at the top here, you can type in just cancer.org and you see the American Cancer Society symbol, recognizing that you're on the correct website. The different cancers are listed, and you can specifically choose breast cancer. When you go through the website, it's easy to formulate. It has all different types of topics about breast cancer, cancer risks and prevention, early detection, understanding, treating breast cancer, reconstruction surgery. These are all topics that, as advanced healthcare professionals, we might not have the time to educate on all of our patients. Unfortunately, I wish we did, but we just simply don't. A lot of times when a family member gets a diagnosis or their relative does, it's kind of a shocking. They weren't expecting it, or it's inconvenient right now in their life, or financially they're worried. So by having a resource that patients, at home in their own comfort, they can look up, or, if they wake up or they can't sleep at night, these are different resources that are available to them. They also may be afraid to ask questions to us, a lot's running through their mind, specifically like, how am I going to pay my next car payment? How am I going to afford this? How am I going to take the time off work to have surgery? What's my husband going to think? What's my kids going to think? So a lot of these questions, they might just sit there in awe, and they will see follow-up specialists or something, but this is just a resource that we can educate family members. Like I said, I like this website particularly because it has all different types of cancer listed. So, if they know a few different family members, and specifically, it's not just breast cancer related, that's kind of why I like it. So specifically, one of the areas that I wanted to touch upon was breast cancer early detection and diagnosis. As our role as continuing practice professional nurses, we really want to be the foundation of early detection and diagnosis. We hope to catch that before it's too late. We hope to catch it in to stage it smaller and so forth. We really need to educate the public on, yearly mammograms and how important it is, as well as, monthly self-checks on breasts. What are you looking for? How do you do it correctly? When should you be checking? And so forth. So this page really goes over the early detection and diagnosis. We can't emphasize this enough for patients. If anything, for women, we should really be pushing this right now. Just because, at times patients want to be in denial, and, the statistics show how often women really are performing monthly breast exams is pretty low, actually. And now with the resources, we can help fight this. So how can breast cancer be formed early? Imaging tests. So I like this page because, we are about all the detection spot. So it goes over what are the screening tests. And some of these patients may never had a mammogram, or, they never had the screening test. They don't know where to go. My local community hospital often will have like a trailer, and, patients can come right up to the trailer and get a mammogram. So resources like that are awesome. It goes over, what are the screening tests? What exactly are we doing at the screening test? Some women are like, what's going to happen when I get there? It goes over different ranges. Women will also ask me, when should I start the mammogram? See, how old should I be? What if breast cancer, BRCA1 or BRCA2 runs in my family? So these go over different guidelines of when women should be tested. Which is really nice. It goes over the mammograms. You would think that, to us, when we hear mammograms, obviously we know, the technology terms and the medical terms, but some people may not even know what a mammogram really is. They know it's some type of test on their breasts, but they don't know exactly if it's X-ray, if it's CT, MRI. They're very confused. And if they don't know or don't have a medical background, I think that we really need to focus and hone in on that. It goes over mammograms, what to expect, and it goes over a huge chunk here of the clinical breast exam, the self-exam, how they should be doing it. Women should be more familiarized with their breasts. They should notice any bumps or any areas, darkening of the skin that could, related to skin cancer and so forth. So I really like this page just because we can utilize it for early detection and diagnosis for our patients. It goes into great detail. It goes into other things too, coping skills. So if they have a family member and they're just not sure what to say or what to do. But the breast cancer early detection and diagnosis is really what I want to hone in on. Just so, if we don't have the time to go over each and every single one of these slots with our patients, they can easily access the American Cancer Society and go over the early detection for breast cancer. I found this topic to be very resourceful for our families dealing with chronic illnesses and conditions because, they can go to this website and they're able to just, read through and understand what is a breast cancer diagnosis. Like I said, sometimes you're in the office and you're just shell-shocked that that's what they found. That's what I felt. This is why I'm feeling this way. It goes over breast cancer reconstruction surgery. Some women are like, I don't know what to expect. So literally a whole blurb right here is on what to expect and questions you can ask your surgeon. I just find this website user-friendly and a great resources for our families in our community to give back and just to educate them because simply, we do this every single day, day in and day out, and, they're not familiar with the terminology. And, a lot of times, unfortunately, they don't want to ask questions because they don't want to feel stupid. Which we just need to educate and give this out. And I plan on, posting this on, social media sites and just getting the word out there because if I can help at least, 1 or 2 family members do self-breast checks every month, or if I can help them understand, better understand breast reconstruction surgery or what to, assume, as well as prevention and, how to eat healthier based on this page, then it was worth it. So by simply, giving our patients and family members websites and resources that are credible, keyword is credible because, we don't want our patients on like Wikipedia or other resources that, aren't confirmed. It really helps, just letting them go through it and reading the terminology and seeing this will hopefully help save lives. I plan to, utilize this resource and as much education as possible in my local community. Thank you.